Hello and welcome to the channel of Andrology and Men's Health Awareness. And in this video, I'm going to talk about the basics of what is premature ejaculation. This is a very common abnormality seen in almost 1 out of 3 males at some time during their life, and this is very stressful for the relationship because the wife, the partner may not be satisfied because of the early ejaculation, and this can lead to marital disharmony and lead to avoidance of sexual behavior, which can be very distressing. So, what is premature ejaculation? Premature ejaculation is said to occur when the man ejaculates sooner than he wants during sexual intercourse. So, he ejaculates very quickly after penetration into his partner. So, because of this, the duration of intercourse becomes very short. Well, after ejaculation, naturally any man will lose the erection, and hence the intercourse will stop. So, when this happens very quickly, or when the man is unable to control this ejaculation to a certain extent to satisfy his partner, it is called premature ejaculation. There is no absolute cutoff. It is a very subjective phenomenon based upon the couple's expectations, partner's expectations, and their ability to achieve satisfaction after a particular amount of time. So, for someone, the 1 minute or 2 minutes might be sufficient to achieve satisfaction, so that cannot be termed as premature ejaculation for that couple, while for another couple, 4 or 5 minutes of intercourse can sometimes may not be satisfactory and hence can be termed as premature ejaculation. So for premature ejaculation, there is no definite definition, but definitely if someone is ejaculating within 1 minute of penetration and stroking, that is definitely premature ejaculation. Normal men in India, or maybe even in the general world population, have ejaculatory time after penetration from 2 to 5 minutes, and the consensus is that less than 1 minute is definitely premature ejaculation, and 2 to 3 minutes can be premature ejaculation depending on the particular couple, and for some it may be 5 minutes. But definitely, if someone is able to hold ejaculation after penetration for more than 5 minutes, then it is normal. There's a big misconception among many men and many couples that they should be able to last very long, or 10 minutes, 15 minutes, 20 minutes. So that is not normal. Normal would be anything in the range of 2 to 5 minutes. Some men may be having decreased, may take a long time, a lot of stimulation to reach the threshold for ejaculation. So for them, the normal time may be 5, 10, 15 minutes, but the general population is 2 to 5 minutes. And in this range, whatever satisfies the partner is generally normal ejaculatory time. So in premature ejaculation, the main concern is that the male is unable to control his ejaculation to achieve satisfactory intercourse for himself or for his partner, and there can be many causes for not being able to control this. If this premature ejaculation happens occasionally in some acts of intercourse, then it is okay. But if this happens in more than 50% of the times you have intercourse, that is, out of 10 times of intercourse, if it happens more than 5 to 6 times, that means it is a cause of concern and can lead to distress among the couple and non-satisfaction. So, what are the causes of premature ejaculation? So, there are different causes. Primarily, it can be natural. Natural means it's primary. So, there is no secondary cause. Meaning the man, since he achieved puberty and since he was having a sexually active life, since that very first time he ejaculates early, that is, he ejaculates within 1 to 2 minutes. So and this is the tendency every time he has intercourse. So this is natural tendency. So why is this natural tendency? That this is because his nerves at the level of the glands, at the tip of the penis are sensitive, more sensitive compared to the general population, and hence he reaches an arousal for ejaculation, arousal of threshold for ejaculation early because he is more sensitive. And second cause in these primary cases is that the serotonin levels in the brain, they are not normal. Serotonin levels in the brain are lower than normal, and this decreased serotonin level leads to early ejaculation. Hence, treatment to increase the serotonin level in the brain can be effective in these patients who have a natural tendency. So that is the first cause. What is the second cause? Is acquired. Acquired meaning the patient initially, after he reached the age of having sexually active life, had a decent enough time, 4 to 5 minutes of time after penetration to ejaculation, but over a period of time or due to some inciting factor in his life, now the patient or the male is having early ejaculation within 1 to 2 minutes, and previously what was satisfactory for him and his wife or his partner is now not satisfactory for him and his partner, and now he is distressed. This is secondary. There's some inciting factor, some cause has caused this secondarily. The stresses can be many. Most commonly, it could be marital conflict, as in there has been a conflict between the husband and the wife or the partner, and hence they are, though that conflict comes in between having natural intercourse, and they are more anxious, and this anxiety leads to early ejaculation. It could be due to some infection in the penis or infection in the testes. This can trigger sometimes, and this generally is treatable, but it can trigger and can lead to this secondary, initially normal ejaculation becoming premature. It could be due to erectile dysfunction. Erectile dysfunction is because the patient is not able to have an adequate erection for penetration, and since he has a weaker erection, he requires a greater stimulation to achieve that erection. And by the time he reaches that erection, that stimulation is enough for ejaculation. So ED can sometimes lead to secondary premature ejaculation. So ED can lead to secondary premature ejaculation. What are the other causes? Is trivial trauma. Some trauma to the penis can sometimes trigger a sensitive spot and can lead to premature ejaculation. And it could even, the trauma could even have psychological impact, and that can cause premature ejaculation. In pain, the patient is anxious or is during the initial acts of intercourse after marriage, or after in the initial new when he is new to intercourse with a new partner, he may be anxious, and that can again lead to premature ejaculation, or otherwise he has a normal ejaculatory pattern. Change of a partner from one to another can also be a cause of premature ejaculation. Diabetes is a very important cause because the nerves have become oversensitized and can lead to premature ejaculation. And thyroid problems, specifically hyperthyroidism, hyperthyroidism meaning overactive thyroid. This leads to a decrease in threshold, decrease in time required to reach the threshold. So hyperthyroidism, the nerves have becoming very sensitive. That can be the cause of secondary. So these are the causes of secondary premature ejaculation. There can be occasional PE where sometimes the patient has premature, sometimes the patient has natural ejaculation. So there is no particular cause for this. This can happen, and that can be treated. So what are the treatment? I'll just enumerate them. The treatment, there is treatment for premature ejaculation. It's such a common problem, so it has multiple modalities of treatment. There is behavioral therapy, as to there are certain behavioral exercises, behavioral steps which can be taken. There is medical therapy which increases serotonin levels in the brain, and there is local therapy in the form of sprays or lotions which decreases the sensitivity of the glands and increases the threshold for ejaculation, hence delays ejaculation. And then there is sexual therapy in cases where it is refractory to the other measures. Psychosexual therapy with sensate focus, where it involves basically exercises to try to distract you from concentrating on the ejaculation, and hence in this way the patient anxiety decreases, and the couple enjoys and the couple is able to normally enjoy the process of intercourse, and therein the natural threshold is reached and the premature ejaculation can be solved. So these are the therapies. I'll discuss in detail about the therapies in my next second lecture on premature ejaculation. Thank you for your patient hearing. Like and subscribe the channel, and any comments can be sent in the comment box, or details can be viewed on the link provided in the description.